Have you ever woken up with a patch of skin that just does not feel right? Perhaps it is a little red, warm to the touch, or even quite itchy. It can be confusing and sometimes a little alarming when your skin starts sending these signals, leaving you wondering what is going on. Well, identifying red and inflamed skin, particularly for conditions like eczema, involves paying close attention to several key visual and tactile signs. You are looking for areas of skin that are visibly pink, red, or even purplish on darker skin tones, often accompanied by a distinct warmth, a slight swelling, and that persistent, irritating itch. These symptoms arise because inflammation is your body's natural response to irritation or damage. In conditions such as eczema, the skin's protective barrier is often compromised, which allows irritants to penetrate more easily. This then triggers an overactive immune response, leading to the characteristic redness, swelling, and discomfort that you can see and feel. To effectively identify these symptoms on your own skin, start by carefully observing the color of the affected area. On lighter skin, inflammation typically shows up as red or pink. However, for darker skin tones, inflammation might present as a darker brown, a purplish hue, or a grayish color, which can sometimes be harder to spot. Next, pay close attention to the texture of your skin. Is it dry, scaly, or rough to the touch? Does it feel noticeably thickened compared to the surrounding healthy skin? Gently touch the area to check for any warmth or swelling, and make a note if there is any tenderness or discomfort when you press it. Crucially, consider if the area is persistently itchy, as unrelenting itching is a classic hallmark symptom of eczema. Also, carefully check for any tiny bumps, small blisters, or any signs of oozing, which can sometimes indicate more severe inflammation or even a secondary infection. Finally, observe the distribution of these patches on your body. Are they symmetrical, or do they appear in typical eczema locations, such as the creases of your elbows or knees, or perhaps on your face and scalp? An important detail to understand is what we call the itch-scratch cycle. This is a common pattern where itching prompts you to scratch, and that scratching then further damages your skin barrier, which intensifies the inflammation, ultimately causing even more itching. Learning to break this cycle is absolutely vital for managing your symptoms effectively. Another specific sign you might notice over time, especially with chronic scratching, is lichenification. This is when the skin becomes thick and leathery from consistent rubbing and scratching. Recognizing these specific patterns helps you better understand the progression and nature of skin inflammation. By actively observing these specific visual and tactile clues, and by understanding the underlying inflammatory processes at play, you are truly empowering yourself to better recognize the early signs of skin irritation or potential eczema. This proactive approach enables you to take timely and appropriate steps to soothe your skin, prevent symptoms from worsening, and ultimately maintain a healthier, more comfortable skin barrier. Your skin is constantly communicating with you, and learning to read its signals is a powerful tool for your overall well-being and peace of mind.